Hi, everyone. I am Rabia Qasim. I am the Vice President of Public Interest at the South Asian Bar Association of New York. Welcome to this special conversation by SABANY, short for South Asian Bar Association of New York, featuring Congresswoman Grace Meng. A brief introduction of Congresswoman Meng. She is a New York City native. She was born in Elmhurst, Queens, and raised in the Bayside and Flushing sections of the borough. She is serving her fourth term in the United States House of Representatives and represents the 6th Congressional District of New York, which encompasses the borough of Queens and includes neighborhoods such as Bayside, Fresh Meadows, Flushing, Forest Hills, Maspeth, Kew Gardens. She is the first and only Asian American member of Congress from New York State and the first female Congress member from Queens since former vice presidential nominee Geraldine Ferraro. She is also a member of the House Appropriations Committee and its subcommittee on state and foreign operations, homeland security, and commerce, justice, science, and related agencies. The Appropriations Committee is responsible for funding every federal agency, program, and project within the United States government. She also serves on the House Ethics Committees. Thank you, Congresswoman Meng, for making the time to speak to us. Welcome.
Thank you so much.
You're a congresswoman from one of the hardest hit districts with COVID in the country, and your constituents have been hit disproportionately. Can you tell us a little bit about what the past few weeks have been like for you, just on a personal level?
Sure. First of all, thank you to SABANY for having me today. We were looking at our dates. I can't believe it's been almost 2 years since we last gathered, obviously in person. I remember in Manhattan. And I appreciate this opportunity to see all of you. And please, again, even if I'm not your direct representative, always feel free to reach out, with whatever people need, suggestions, questions, etc. I will say it's been a really difficult few months, I guess, by now. I remember the second week of March, I was at a friend's wedding in New York. And within days, we were all asked to self-quarantine here in New York. And since then, things in the last few weeks have stabilized a bit. It has plateaued, obviously, here in New York. But as we all know, New York, and especially my home borough of Queens, has been the hardest hit. New York has 30% of the deaths of the entire country. And I remember participating in bipartisan briefings in late February. That was like our first one. And I was thinking about the people in Washington State and how they were hit, and talking a lot to my colleague Pramila Jayapal, who was telling us seemingly horror stories about what was going on in their areas. And I never imagined that the pandemic would hit us so hard. The first few weeks, I would say late March, were really difficult because I feel like my role as an elected official was completely redefined. We spent a lot of the first few weeks thinking like, okay, what can Congress do in terms of legislation? But soon it became, we were sort of, as with many offices, I'm sure, became a hub of receiving calls from nurses, doctors, lab technicians, people who were literally crying to us over the phone saying that they didn't have things like the masks and the PPE. And so, I felt in some ways our office had been transformed into trying to get them the materials that they were needing, whether it was PPE or ventilators. And so obviously things have stabilized a little bit. Everyone knows Queens now. All my colleagues know Elmhurst, they know Queens. We have Elmhurst Hospital. And so we're really thankful for so many people across the country who have literally supported our borough and even donated supplies. Elmhurst Hospital at one point had a volunteer from every single state in the country.
That's fantastic. That's fantastic. Are you hearing anything from your constituents about what's going on in the ground here in Queens that the public and the media aren't seeing, or that the media isn't reporting?
Well, it's really interesting that you asked this question because New York was at the forefront, and I would try to share what was going on because just like I learned from, colleagues like Pramila about Washington State, I was trying to warn them about what might come to their areas after it hit New York. And thankfully, no one's been hit hard like New York has. But we were really learning things, not necessarily from the media, but from everyday people on the ground. You know, I first learned of PPE shortages not because of a newspaper article or because someone up high told me about it. It was because we were getting calls from within the hospitals, you know, doctors who were calling us crying, saying that they, you know, were preparing their wills, that they were ready to die. So, you know, these were really the ways that we were getting the information. And oftentimes throughout this process, it really has been like that, from PPE to businesses with problems with small businesses, to now more about, you know, helping to assist our food pantries. Almost all our information has come from the ground up.
That's really important. What issues have your constituents been reaching out to you about now that things have stabilized a bit? And what are they seeing now? It's not as much, I'm assuming, the PPE shortages. What are you seeing now? What issues are they having now that they could use assistance with?
Sure. So PPE obviously was first and foremost PPE and ventilators, and that has stabilized, although there's still lack of PPE in many places. But you know, another problem we've heard of. So I think housing and food, and just basic cash assistance to help people pay mortgages and their rents and utilities are some of the top issues that we've heard about. And with the cash assistance, as you know, the first major bill that came out of Congress, it did provide cash rebates for many people. However, if you did not have a social security number, or if someone in your family didn't have one, even if you had an ITIN, if you paid taxes, you were not eligible for this money. So there were still a lot of people in my district and throughout New York that virtually didn't receive much help from what Congress passed.
So what efforts has your office been able to take to help your constituents about these sorts of issues?
Right. So first, on the ground, I think we heard a lot about issues like food and housing. You know, it's such a luxury for many families to be able to safely self quarantine. It's easy for some of us. We can go into our homes. We're lucky enough to stay home. But what if you are living in a crowded apartment? What if you're, you know, in a roommate situation where there's many people in our community? There's like four or five in a single room. And what if one of them at least is an essential worker or a healthcare worker? And so we work with some local elected officials and South Asian, you know, advocacy groups who worked on the ground, like Adhikar, and they were telling us, like, look, we need to work with the city. The city has vacant hotel rooms, for example. We need to make sure that people can safely quarantine. Otherwise, it's going to continue to spread. And so that's one way we work to the city, and the city has so far provided a lot of rooms for a lot of folks who need it. And in terms of food, what we're seeing more and more is the food insecurity. And I have to give a plug to so many groups on the ground who are literally, we're trying to match them up with people who can either donate money or donate food. I'm working on legislation to get food from farms in New York and around the country. Farmers don't have the ability to package and to sell their food because restaurants are closed. So we have farmers around the country dumping their milk. They don't dumping their produce because no one's buying it. While here we have a gap. So we're trying to, you know, fill that gap and get the food to the people.
That's a really important point, because it's shown that just COVID-19 has had such a dramatic impact on every aspect of everyday life, from restaurants to food and things of that sort. So what are some of the lessons government should take away from this moment?
Well, I'm biased because I'm in Queens and I represent a community that is very diverse, high immigrant population, or you're a child or granddaughter of immigrants. We have seen how insufficient investment in our health system has led to a lot of these disparities and such a severe result in Queens. If you take a look at the data that was provided by the city, most of the people in Queens who died of the coronavirus had an underlying health condition, which means either that they weren't seeing the doctor enough or they weren't getting the treatment that they needed, and they had conditions that needed to be better taken care of. So we still need to make sure that we are investing in those systems that would provide early access to healthcare, and just hospitals in general. You know, Queens disproportionately has a lower number of hospital beds per person than all the other counties, and so that also leads to why we had such a severe number of deaths.
Are any of these issues going to be addressed in the next phase of the stimulus? You said you're working on legislation right now. Is any of this going to be addressed in the phase 4 of the stimulus package? And what would you like to see in the package for New York and your district specifically?
Sure. Well, we're actually voting on a bill tomorrow that is not a perfect bill, but it really does address a lot of the issues that I wasn't satisfied with from the first vote, because I didn't think that that went far enough. And so basically, you know, one of the things we need to do before we even think about reopening the country is to make sure that we have testing and treatment available for everyone. You know, I was thinking, I'm a mom of 2 young kids in public schools, and even when someone in the school or class gets head lice, you know, our systems are on it, you know, like they are treating, they're finding out the source, they're making sure you stay home, and that's not even a, you know, a deadly situation. So we should at the very least be doing that for the coronavirus. So in this next bill, it does have a lot more funding for hospitals and for mobile testing, which is important for immigrant communities and rural areas as well. Another thing that it provides for, which I'm really happy about, is that it provides hazard pay or money for essential workers. Essential workers, of course, we know of as first responders, healthcare workers, but in this situation, you know, just like in 9/11, when we watched first responders rush into the towers, we have had restaurant workers, healthcare workers, pharmacists, grocery store workers. They are headed to work every day, risking their own health and their own lives. And so it has hazard pay for a long list of essential workers like that. And then another part that it adds to is making sure that the cash rebates, the stimulus money, can go to people if they're ITIN holders, which is really important for Queens, because a lot of people were left out. Probably around 200,000 people in New York City were not able to take advantage of the stimulus money last time.
Absolutely. And a lot of that has been due to the fact that some of these folks are, like you mentioned earlier, undocumented or don't have a social security number. Will they be included? Will there be aid provided to support the undocumented workforce? New York City's undocumented population reported in 2018 was approximately over 500,000. It was approximately 560,000 people. So will any of this aid be available to them?
Yeah, so if you are an ITIN holder, you will be able to take advantage of the cash rebates. Last time it was 1,200 a person, an adult, and $500 per child. And now they changed the age. So if you are a college age dependent on your parents, for example, you would be able to benefit from this cash assistance as well.
That's good to know. And then also, I just wanted to turn a little bit and talk to the immigration aspect of this. And you, along with your congressional colleagues, wrote a letter to the Department of Justice and the U.S. Immigration and Customs Enforcement, asking the agencies to release ICE detainees so that administrative proceedings for the duration of the COVID-19 pandemic are not necessary. Have you received a response to your letter?
No, gosh, we wrote a while back and we have not had any sort of response. I mean, you know, just in general, we need more transparency, even when it's not during the pandemic. But we are really concerned about the conditions, whether it's in our detention centers or in the Bureau of Prisons, state and federal prison facilities. They are obviously people who are living in very close quarters. We need to know that they are, you know, the clean conditions there. But if you are elderly, if you are, you know, sick, comorbidities, if you are almost done with your sentence, you know, there is no reason why some people should be subject to potentially having a higher risk of getting the coronavirus and dying.
So I'm assuming they haven't given a rationale for keeping the courts open during the COVID-19 pandemic.
Correct.
Okay. And can you point, are there any resources you could point any immigration attorneys and individuals to trying to navigate the immigration courts during this time?
There are a lot of good organizations. Off the top of my head, and I know I'm leaving a lot out, but Legal Aid Society, Make the Road New York, ACLU are some of the organizations that are working on this.
Is anything in the works from Congress to help support legal immigrants who may be out of status related directly to COVID-19 in terms of?
I think right now most of the focus is on trying to get them direct help, whether it's cash assistance, food, job stability. So in terms of immigration related cases, not that I know of right now, but definitely something we could look into in the very near future.
Is there a point where you can say it'll be safe for New Yorkers to go outside and to go back to work?
I mean, that's a really good question. I don't know what it will look like, right? Even when we feel comfortable to lift the pause here in New York, the governor does, and even when we're all allowed to, continue life as we know it, I don't think it ever gets back to normal, as we knew it, like in February. I can't imagine even if we were allowed to go to a concert. If people would feel comfortable being in a crowded room with so many people, obviously not social distancing. So I think we're a long ways off from that. I know there are a couple areas in New York State that are sort of reopening and then starting tomorrow, I think. But here in the city, it's hard to imagine.
And so have you had any conversation with the state and the city, including Governor Cuomo, Mayor de Blasio, and when you see the state and city will reopen?
Well, honestly, people have different perspectives. I am not rushing that at all. And maybe it's because I've seen it in Queens and I've seen how hard hit families are and the suffering that so many people around us have gone through. But I do think before we do that, we need to make sure that we are providing more access to testing and tracing, even in our own nursing homes in a contained space. We haven't been able to accomplish that yet. And so for the general public, I think we just need to do a better job at reaching more people with the testing and the proper tracing.
What efforts is the federal government currently putting into place such that testing and tracing become commonplace, if any?
Yeah, so in this next bill that we're working on, that we're voting on tomorrow, it's called the HEROES Act. There is a large sum of money for hospitals, for testing, for mobile testing, to help hospitals and to community centers to make sure that we are providing money for testing, but also whatever is in a testing kit that the different facilities need. I'm trying to look for. So it builds on, it's $75 billion will be allocated for testing.
Do you know Oh, sorry.
Go ahead. Sorry.
Do you know how much of that would be for New York specifically?
I don't have those numbers yet. Yeah,
Okay.
New York will be taken care of. I believe New York, there's different formulas for different parts. I know New York, the mayor and the governor specifically asked for a dedicated pot of what they call state and local funding. This would allow them to use money that's not just for coronavirus purposes, but also to make up for lost revenues. So they wouldn't have to, let's say, make budget cuts to our schools, our teachers, our firefighters, things like that.
That was actually going to be my next question, if we could expect to see federal government aid for municipalities, because we were absolutely disproportionately impacted by COVID-19, and if there would be any help from the federal government in that sense. And
yeah, definitely. So definitely to your question, what we did was tweak the formula that the money was given, so it's not based on just population, for example, or unemployment numbers, but we added in the factor of the rate of infection, the number of people who are infected, because that obviously is what we believe as New Yorkers, the formula that needs to be used so that New York gets money. We're told that New York has a budget gap of about $14 billion, and this legislation that we vote on Friday would plug in about 22, $23 billion.
What precautions do you think will be taken in opening the economy as well? Do you think that need to be taken in before we can get back to a full start?
Yeah, I mean, I do think I'm not a healthcare professional, but I do think that we need to have a better sense as to where the disease is, where it has been, and how we can hopefully one day soon be able to provide treatment for people. It's obviously a super contagious disease, and as we start thinking about reopening, if you think about it, my husband's a dentist, and what his whole profession, they're like one of the top three riskiest categories. But as they reopen, just going to the dentist, they are literally coming out with all different types of equipment and measures that are taken, that will be like nothing we've ever seen before. Clear dividers between the patient and the dentist. We've seen pictures of even gyms from other country where they have like dividers in between all the treadmills. So life as we know it will, I think, be changed forever.
Absolutely, or at least for a very, very long time.
Yeah.
Least. And so my next question is, May is also known as Asian Pacific American Heritage Month. And it's a very difficult time for a lot of communities right now, but especially the Asian American community, which has faced increased discrimination in the wake of COVID-19. And you have recently introduced legislation to help combat this issue. Can you speak a little bit about that legislation? Is there being enough to address the problem, and what more should be done to address this issue?
Sure. I think soon after, I heard the Republican top leader, Kevin McCarthy in Congress, tweet about calling it the Chinese virus. It just really upset me that a colleague would do that. And not only that, when I tried to approach him to talk about it, to describe what the Asian American perspective was, and that people were literally getting harassed, bullied, and physically attacked, there wasn't much interest on his part. And so I thought that it was really important that we put a united front as a Congress, and to come up with a resolution that shows we're united against Asian American discrimination and hatred during this COVID-19 crisis. And so we're also proposing legislation to call for the federal government to better track these instances of hate crimes so we know when and to whom they're happening around the country. It's important. This country has a history of discrimination against Asian Americans. People are really scared. I know of people who refuse to go to the supermarket because they don't want to risk being, made fun of, or worse yet, physically attacked. It's really important that we speak up and try to get stories from people who are not comfortable speaking up. And I also try to see this as a bright light at the end of the tunnel. This gives our community the opportunity to strengthen ourselves and to build coalitions with other communities. We've had a strong showing of support from groups like the NAACP, the ADL, and they've been so vocal in supporting our AAPI community. And I think that going forward, regardless of whether it's this issue or another one, this just gives us the opportunity to better work together. And someone said, oh, they're so sad because it's like the API community is back to square one. And I absolutely don't think so. We have Asian American elected officials, we have groups like SABANY, and we have a platform that our ancestors decades ago did not. And so let's use it, let's support each other, and let's make this virus of discrimination go away as well.
That's a really good point, because this is something that I've heard a lot about on the ground happening in New York, and the efforts that have been taken in the city. Have you been hearing as much from your constituents about why they aren't going? Have you been seeing why they're not reporting instances, or where they're not reporting the instances to law enforcement and things of that sort?
I think sometimes people don't recognize it as discrimination, right? Like if someone is mocking you by pretending to speak your Asian language, for example, if you don't speak English, you might not realize that they're making fun of you, right? I've seen this happen to like a grandma around me, right? And so there are stories that are happening that we don't know the full scope of even yet. And we have to let them know, people who do realize and who do want to report, that we do have a support system out there for them.
And is there any resources that you can point to us to that you think someone who doesn't, maybe necessarily English isn't their first language, how would we should be reaching out to them?
Sure. Well, they should always feel comfortable reaching out to their local elected officials like myself or my office. There is a website, I believe it's stopaapihate.com. We should check the accuracy of the website, where they are collecting stories and you can be anonymous, and we can help facilitate that too.
Okay. Well, thank you so much for taking the time to speak to us, and thank you all for joining.
Thank you, everyone.